by the end of the night in America, more than likely 3 women would have been killed as a result of domestic violence. And even in New York City, our NYPD answers about 250,000 calls, and our hotline exceeds about 100,000 calls.
As millions of people prepare for the Super Bowl, gathering with friends, celebrating, and watching one of the biggest sporting events of the year, advocates and service providers are bracing for something very different. Because year after year, research shows that major sporting events after them, including the Super Bowl, are often followed by a surge in domestic violence calls. What looks like celebration on the outside can be, for many families, become a moment of increased danger behind closed doors. Domestic violence doesn't pause for big events. It doesn't pause for holidays, and it doesn't pause for public attention. That's why this conversation really matters. I'm joined by Nathaniel Fields, CEO of the Urban Resource Institute, the largest provider of domestic violence shelters in the United States. On any given night, URI provides safety for thousands of women, children, and men, and even their pets, while working year-round with tens of thousands of people who are survivors of violence, escape violence, and begin to heal. In this conversation, Nathaniel explains why domestic violence remains a life and death issue, how moments of heightened stress and public events can increase risk, and what it really takes to interrupt cycles of violence, not just for individuals, but for families and entire communities.
So we at the Urban Resource Institute, we started our work in 1980, and we really focused on the client, the victim, so really much victim-centered work and the community. And that allows us to really understand the multiple risks that clients face as it relates to domestic and gender-based violence. And understanding the risk, it helps us to shape our response in terms of services. So at Urban Resource Institute, we're the country's largest domestic violence shelter provider. On any given night, we have about 4,000 women, children, men, and their pets in one of our residences, one of our shelters. And on an annual basis, we work with about 40,000 people to increase safety and help them heal. And why this is so important, because a lot of the data, and people have heard this, that 1 in 4 women and often 1 in 7 men will be impacted by domestic violence. We know that by the end of the night in America, more than likely 3 women would have been killed as a result of domestic violence. And even in New York City, our NYPD answers about 250,000 calls, and our hotline exceeds about 100,000 calls. So, the lethality, the life and death, the urgency is such that our response at the Urban Resource Institute had to be really assess the risk factors and to be able to set up an organization to be able to really do very good work.
I think right now we have a lot more challenges than perhaps you've had in the past. You've seen firsthand what survivors face and what they have to do to try to rebuild their lives. What would you say are the biggest challenges survivors are facing right now?
Right. So I talk generally about risk factors, right? So survivors are sometimes, when you think about it, somebody may be faced with, uh, I'm a survivor and I'm also an immigrant, and I'm dealing with, I may not be safe in my home, but if I leave my home, I may be even more unsafe. So that risk factor, should I stay or should I go, is something they're balancing. And so one of the things that we're seeing around the country is that people may stay in an unsafe relationship uh, if they're an immigrant. And we saw this during COVID. If I leave my home, I may become infected. So I'll stay in an unsafe relationship, so I don't have to deal with that other risk factor, which may increase my challenges. And so over the years, we've learned about a lot of these risk factors, and we've done things about it. So that's one of the things right now. Historically, 10 years ago, when we started to talk to survivors more and talk to communities and our folks in research, we understood there were a lot of barriers for those seeking safety. Uh, I could tell you some innovative work with URI. For example, we learned that 50% of victims of domestic violence would not leave an unsafe relationship if they couldn't bring their pets with them. Pets were part of the family. It provided unconditional love to them. They weren't going to leave. So instead of judging and uh, the victim, what URI did was partner with the animal welfare community. And in New York City, we became the first ever organization to work with people and pets in our PALS program, people and animals living safely. And you remember what I talked about? 1 in 4 people, the amount of calls NYPD answers. We need to have responses. And we partner with the animal welfare community. We were great at working with people in trauma, not so much with animals, but we knew how to go get that help. And we created an amazing initiative, and we ultimately passed the Pets and Women's Safety Act of 2018. And now it's nationally done. It's internationally engaging people and pets in order to increase safety. So URI is constantly looking at the here and now and some of those barriers that show themselves, and what do we do about it? Not by ourselves, but as a sort of a community.
Are you finding that with all that's happening in the world today, especially with our government and such, are you finding challenges organizationally to be able to serve the needs of the community that you want to help?
Yeah, I mean, we're terrified about some of the things happening. Listen, the federal government still has the ability to do so much good, right? They have the resources to say, how do you operate stand-up shelters? How do you provide uh, 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 a supplemental nutrition and other types of food items? When someone is leaving, uh, truly, most of what they have stays behind, right? So the largest population we provide services to are children. They're almost like the invisible victims of domestic violence. And so if you're leaving with your child and you're going to a DV shelter, you may need support. You may need assistance. You may need food. And so when we hear about a government shutdown, we get concerned. Well, will those basic needs be there to support the person when they leave? Or they may be wondering, well, why would I leave to go into a worse situation than where I am coming from? So this current situation is very concerning. We're definitely trying to let people know, your listeners know, that we're still open as a domestic violence community, and there's still services there, and for the community to really work to ensure that these services continue.
I know you've probably met countless survivors and families that have been helped through your work. Can you share maybe one or two stories that really have had really a big impact on you personally?
Oh, wow. So I would say a story that had a big impact on me personally is talking to a survivor who, well, was actually two story, but one was she was a working person. She came into shelter. She was embarrassed and ashamed. She couldn't figure out how this happened to her. Uh, to find herself in hiding in a shelter uh, based on her station in life. And as she stayed with us, she probably would say she wasn't the easiest client to work with us, but then became in a place where she was able to accept help, to start to understand the impact of violence in her life. It was intergenerational violence, so she understood um, some of the impact her mother's domestic violence had on her life. And she started to move forward and started to recover and started to heal, not recover, but heal. And as she was healing, she was diagnosed with cancer. And right, so she talked about how difficult it was to make so much progress and then have this sort of life to have this life-threatening event happen. She talked about how our team members, how our staff members operated out of the job description. Yes, she had nurses coming to the site. Yes, she had, but they were there with her in her room. They were there helping her with her child. They were there showing that level of compassion. Uh, she was able to recover. Cancer went into remission. She had life goals that she wanted to pursue. And as she healed, she was able to pursue those goals. And I caught up with her later on, and she remembered our staff members. She marked, I wasn't the easiest client you had, but without those staff members being there for me in my life at that particular point, I wouldn't have been able to move forward and do the great things I'm doing now. And that was just a wonderful story for us to know that committed people at the right place could partner with somebody, they could heal and do amazing things and break cycles, sort of an intergenerational abuse. She had a child, she understood the importance of being able to seek help. Trauma that hasn't been dealt with or intervened in some way will recreate itself in different ways. You'll see people causing harm, or you see people more receptive to being victims of violence in terms of intimate partner relationships. So it was a story that stuck with me and continues to stick with me.
Well, I know URI is not only helping survivors, but also probably leading prevention efforts through education and advocacy. What policy changes, I guess, do you believe that that would create, I guess, the most meaningful impact over the next few years in the future?
Yeah. So we're a learning organization too. We're constantly learning from survivors, the community, the researchers. Prevention is hard to always prove what you're preventing and quantify it, but we know early intervention really works. So we work with thousands of young people in high schools, and we work around identifying signs of abuse.
Hey, if conversations like this are meaningful to you and they matter to you, please take a moment to subscribe to The Color Between the Lines. It's free and it helps this work reach more people and allow me to continue doing these type of interviews, bringing voices like this to light. Thanks so much. Now let's get back to the conversation.
And what's really great about that is that before high school individuals get into an intimate partner, a domestic violence relationship, they know what to look out for. We also found that when we started doing this work many years ago, over 10 years ago with high school students, they were already involved in domestic violence relationships. With that, they knew how to get help and get out as early as possible, which led us to working with people younger. So now we work with folks in junior high schools, engaging in healthy relationships. We also train up peer leaders so they can engage their peers in healthy relationships, a wonderful sort of peer group environment, young people with knowledge about domestic violence and creating a culture where they're holding people accountable. So I've been doing this for a while. I am so optimistic when I see those young people engaged, not standing for it, understanding their own unresolved trauma and how it could show up and getting help. On the other side of this, which is it's newer information, a couple of years ago, we started working with survivors and we started to hear more and more, I may not be ready to leave a relationship. I want the abuse to stop. Is there work that you can do to the person that's causing me harm? Our work was around so much victim focus, and how would we work with an abusive partner? How would we work with those who do harm? And it was still controversial many years ago. Some people believed that this abusive partner could not change, right? And so we went from a society of doing almost nothing behind closed doors, it's invisible, it's a family problem, to trying to arrest our way out of ending domestic violence. And we held the abusive partner more accountable with, creating laws, making it a crime, imprisoning, and we need that accountability. But we didn't do any intervention. So when a person came out, they would only go on to harm people that they cared about. So the cycle continued. Or if the person wasn't ready to leave and wanted to stay in that relationship because they may still love the person, they may have children, whatever the reasons. So we created what we call our abusive partner intervention program. And we started working with those who do harm. We started to talk to survivors, we talked to the researchers, we went across the country, and we found those promising practices. And now it's amazing because we're doing so much work in the space, and we have a groundbreaking report coming out next week with the Urban Institute, not to be confused with the Urban Resource Institute. The Urban Institute, of course, amazing research entity that helps practitioners, organizations like ourselves who are in practice develop or gather research to how do you know what you're doing is having that desired outcome. And what it's showing is that our interventions are really promising practices that are having an impact on those who do harm. So I'm teasing it a little because we're still embargoed to next week, but that helps shape a field. When you look at the level of lethality, the prevalence of domestic and gender-based violence, they have other interventions to hold the abusive partner accountable. And Esther, I looked at your background. You've been reporting in different ways a long time. There's very little messaging going out to those doing harm. You have an option. You have choices. You can stop hurting people. You can reach out to organizations like the Urban Resource Institute and try to figure out what is creating this in you? Why do you think and why do you behave this way? And how do we help you to stop hurting people you say you love? So stay tuned. Next week, that report's going to be out, and it's going to really help to inform what we do in terms of helping people stay safe.
Before I ask where people can find you to perhaps help and what ways they can help, I really wanted to know, why did you get involved with this type of work? What was your, I guess, your aha moment to make you want to help other people in this way?
Yeah, I guess it's not one of those sectors where you say, I want to be a doctor, lawyer, police officer. I want to work in nonprofit to help victims of domestic violence and those dealing with housing insecurity. Listen, I would say I had both the opportunity and challenge in growing up at a certain time in Brooklyn, New York, where crime was running amok. I think our murder rate was just under 3,000 a year. It's like 300 a year now, a year in New York City. Uh, Still too high, but you could imagine nearly 2,800 people being murdered and how chaotic it was and how much violence was around the neighborhood. I still remember people where I lived gathering together in those sort of block associations and in that little sort of area to stand together and do something about it. And coming together, they were able to uh, create the hope and create a sense of being able to look at the collective power and move forward. I would say that in my family, a mother who's never ending hopeful, uh, leaned into me to impacted me to say that I would want to do something in the helping field. And as I got more involved in different aspects of the helping field, I definitely wanted to work in safe housing and then really work with domestic and gender-based violence full circle from the prevention work to having one of those safe beds where somebody's ready and in need of a safe place with a committed staff to now looking at those who do harm. I've seen when people come together, the amazing work that we can have in unleashing the potential of people, how our communities become stronger. So this is an opportunity to lead Urban Resource Institute and to be in the sector. And I'm grateful for folks like you who give us a platform, I should say, to be able to raise awareness. Somebody's listening right now who's a victim and maybe feeling alone and ashamed or many emotions that they know they can contact the National Domestic Violence Hotline at 1-800-77 SAFE, 1-800-799-SAFE, or they can reach us at urinyc.org to learn more about it.
That was Nathaniel Fields, CEO of the Urban Resource Institute. If you or someone you know is experiencing domestic violence, help is available. You can contact the National Domestic Violence Hotline at 1-800-799-SAFE. You can also learn more about the Urban Resource Institute, including how to support survivors, help someone you care about, or access services by visiting urinyc.org. And for more conversations like this one, please subscribe to the Color Between the Lines podcast on iHeartRadio, YouTube, or wherever you listen. I'm Esther Dillard.